Hello guys, welcome back to Dr. Arshad Nadeem Awan ultrasound and radiology teaching videos. Hope you're all okay, you're all enjoying your life and also you're enjoying practicing radiology. In my previous lecture, I have talked about the radioisotopes, radiopharmaceuticals. So relating to that radiopharmaceuticals, my second video is regarding the iodine 123 and iodine 131 isotope or radiopharmaceuticals. As you all know that there are certain radiological tools which we help to diagnose the different pathological processes. The radioisotopes are the very important one, and it play a vital role in the diagnosis of the patient. So far the technetium 99 was concerned. I have talked about that, and today I'm going to talk about the iodine tracer 123 and iodine tracer 131. Both are used for the thyroid imaging, for the detection of the hot and cold thyroid nodule and different other masses and structural abnormalities of the thyroid. So it is very important. So I'm going to discuss about its half-life, its physical life, its advantages, its administration, its disadvantages. All will be included in this video. So hope you will benefit from this video, and this would be regarding the iodine radioisotope. So let's start watching video. Radiopharmaceutical iodine 123 is the agent of choice for the thyroid imaging. When you want to image the thyroid, so always think for iodine 123. Its physical life is 13.3 hour and it start emitting photon at 159 keV. 200 to 400 its dose, and you should have to give it 24 hours prior to imaging, and its radiation noise is 7.5 mRad. Radioisotope iodine 123 readily absorbed from GI tract, almost 10 to 30% in 24 hours, and distributed primarily in extracellular fluid spaces, then trapped and organized by the thyroid gland, trapped by stomach plus salivary gland. So far as excretions is concerned, their excretion is via kidneys in 35 to 75% during the first 24 hours, and also through the GI tract. If I talk about the iodine 123 radiopharmaceutical, so the first and the topmost is it has a low radiation exposure. This is its best characteristic. And the second thing is, as far iodine 123 is concerned, it has an excellent physical characteristics. Its uptake plus scan with one agent, and it's organophile. So these three are very important advantages of the iodine 123, being with an excellent radiation, a lower radiation dose, and excellent physical properties. Some of the disadvantages of the iodine 123 radiopharmaceutical is that it is very expensive. It's more expensive if you are going to compare it with technetium 99 per technetate, so it happens to be more expensive. The second thing is it is less available with short shelf life. You can't keep it for long, so that's why it's less ability. The third disadvantage is it is more time consuming, and it has a radionuclide impurities. It has a higher dose to the thyroid, but above all, the most expensive, being an expensive and less availability with a short shelf life and more time consuming, happens to be a disadvantage of the iodine 123. With regard to iodine radioisotope, the another radiopharmaceutical is iodine 131, and that is indicated for the thyroid uptake studies, thyroid imaging. It can also be used for the treatment of the hyperthyroidism. It can also be used for the treatment of functioning thyroid cancer, and it can also be utilized and used for the imaging of the functioning metastasis. So it has multiple variety indication, and you can use for the thyroid purpose, but also as a treatment for the thyroidisms and also for the functioning thyroid cancer. As a treatment it can also be used. Iodine 131 radiopharmaceutical half-life, physical half-life would be 8.5 days, and its gamma energy of 364 keV. So for the dose is concerned, it should be 30 to 50 is equal to 50 rad of thyroid. Keeping in view the advantages of radio iodine 131, so the first and important advantage is that it has a low cost, identical to iodine 123. The second important advantage is it can be used for the ectopic tissue search, and it has the advantage of uptake and scan at the same time. Few of disadvantages of iodine 131 include that it is too energetic for gamma camera, so it is well suited for rectilinear scanner with limited resolution. The second disadvantage is it has a high radiation exposure due to beta decay, so it prohibits use for diagnostic purpose, so it is not used for the diagnostic purpose. The third thing disadvantage is ectopic thyroid tissue just as well detected with iodine 123 or technetium 99 per technetate. So when we can use the iodine 123 and technetium 99 m per technetate, so I think then the usage of this iodine 131 should be prohibited, because it is no longer used for the diagnostic purpose, and it is usually used with respect to the treatment of the hyperthyroidism and for the functioning thyroid cancer.